Hi and welcome to the channel. I hope you're having a good day. So today we'll be talking about what it's like to work as a rehabilitation assistant. My name is Julia and this is I. And we actually met a few years ago working as rehab assistants at a big hospital. So we'll be sharing just a little bit of our experience. And as a rehab assistant, you are basically helping out the allied healthcare professionals who are therapists, so physiotherapists, occupational therapists, and speech and language therapists, working either on one-on-one basis with the patients themselves, or maybe doing some double sessions with the professionals. So anyway, we'll go into that in a little bit more detail, but that's kind of the crux of it. You start off at band 3 as well, and then you can get a position at band 4 as well, which is what I is doing currently. So we'll mainly focus on being a rehab assistant, but then I'll ask you a little bit what it's like to be a rehab therapy technician. I think that's what you're doing, which is a band 4 position. Cool. So as the first question, I'll just be asking you, what did you do on a day-to-day basis, but also which team you worked with.
Okay. So I started in neurosurgical team, and I was on a ward specializes in surgery in spinal cord. And so as a rehab assistant, we kind of support the therapist, like you said. So physios, OTs, and we didn't have much SLT input in the surgical team. But then we had like our own caseload, so we see patients independently, and then when the therapist needs support for like walking or like practice like sit to stand and things like that, we kind of have the double or joint session with the therapist. Yeah, so that was like, and then we had some admin stuff as well, so we supported the therapist with referrals. So it was like a specialist acute hospital, so after the surgery they had some recovery period and some rehab, and then we had a rehab unit like you first started. So some of the patients who are from the area, they went to the neuro rehab unit in the same hospital, and then other times, like if they're from different places, and then they went back to their own kind of local hospitals. So we kind of supported the therapist in the process of the repatriation and referrals to the community. Mm-hmm. Yep.
Cool, thanks for that. So yeah, I think it's a good point to mention that you do the therapy side of things, but actually there is admin involved as well. And whatever you do, you support the actual professionals. So I think for myself, thinking about the split between the OT, the physio, and speech and language, like you, I didn't do that much speech and language stuff. There was a little bit in the sort of medical team, and so I guess speech and language therapists, they don't just do speech, they do swallowing as well. So what I was helping out was with swallowing questionnaires. So I just asked people if they had any difficulty swallowing things, or if anything, if they've ever choked, things like that. And then I'd pass this information on from the sort of semi-interview, and then the actual SLT would see them. And then from the physio, like you mentioned, things that we might be doing are sit to stand, which sounds really simple to us. We don't think about it, you just stand. But actually some of these patients were non-medically stable and they were just sitting in bed for a really long time. So they need to almost relearn that motion, but also their body needs to be used to, again, standing upright. So the sit to stand was one thing. We also did what was the name of, there was the table that you'd the tilt table. Thank you. Yeah, that's another thing. So if someone's laying down for a long time, again, something to do with body pressure, you need to get them standing. But at some point, if their own legs can't support them, we would put them onto the table, help support the therapist, and then it would, from laying position, just
the patient with like 3 bands, and then kind of the table go up slowly, and then so they will go on the standing kind of position.
So yeah, there's definitely a lot of equipment that we get, sort of physio equipment that we used to. So yeah, sit-to stands, helping people walk as well. And again, as you mentioned, things like walking, you usually need 2 people for that. So maybe one person supporting from one side, the other from the other. This is why the physios need assistance to kind of help them. Sometimes we're doing things for the core as well, so maybe helping a patient to sit straight when they weren't able to. So yeah, I think those are some of the main things that come to mind. Also passive stretching, that was a big thing. So again, sometimes patients can't move by themselves. So what we would do is just have an individual session and help them stretch their...
So we can passively move the limbs, and then when they have more power, we can do active assisted. So patients move their limbs, but we kind of support them. Yeah.
So again, it sounds like a basic thing, but actually when you're laying down, not moving anything, you need to keep the range of motion. So we'd be moving hands, all sorts of limbs you can have would probably be moving. So that's another thing. What did you do from the occupational therapy side?
So it was more like wash and dress in the shower or on the bed, or like grooming, like brushing hair, shaving, brushing teeth, and or sometimes like cognitive rehab. So when they have like memory problems or other cognitive impairment, we support them in like orientation and things like that. And I think, like, I don't know if it's right, but for me, OT is more like upper limb rehab. So they have like splint for the upper limb, or like passive range and like sensory practice as well. So I think it's more kind of OT in a way to me. What do you think?
Well, I guess it depends. We had a whole upper limb program where people are doing a lot of things with their hands. Is sort of getting back this really fine movement that tends to come a little bit later. So definitely a lot of that. And as you said, wash and dress. So OT, it's difficult to define, but it's how would you define it? Do you think
it's more about like ADL, so activity of daily living, so it's to support them, like physio. Someone told me like physio is like to kind of support patients in a way that their muscles get stronger, and then if they want to do football, the physio will support them to stand and kick the ball, and then OT will support like adjusting, like how kind of, I don't know how it goes, how to kick the ball. So it's like a fine motor kind of adjustment. I don't know if that's right, but like for me, OT is more like daily living things, like brushing your hair or brushing your teeth or eating. So I don't know.
I think that's a good summary. So physio kind of being more about the sort of more physical side, but actually we're not just moving our hands for the sake of moving our hands. We're moving the hand so that we can grasp a cup and have a drink. So it's very much ADL's activities of daily living. So there was a lot of just helping people wash and dress, actually helping them in the bathroom or helping them comb their hair and things like that. What we did as well at some point was occupation therapy groups. So this was, I don't know, maybe like a reading group or in the kitchen. Oh my gosh, there was a lot of kitchen. Oh, how could I forget the kitchen? So we had an occupation therapy kitchen, and again, these are things that we take for granted, but making a cup of tea or making a meal, those are big things. So what did you get up to in the kitchen? How did you help the patients there?
So it's like it's usually a very simple thing, like making a cup of coffee or tea, or like making toast, or sometimes when they're more kind of like capable, they can make like a big meal, like lasagna or something. So it's OT thing, isn't it? Rather than but I think in a rehab unit you guys had like a breakfast session. So I think I wasn't too involved in that, like kitchen things on the surge team, but I think if you go to different teams you are more, because the kitchen is in neuro rehab unit as well, so you have more access to the kitchen.
If you're on, if you just had a surgery, you're probably recovering from the surgery rather than making yourself cups of tea. So exactly what you do will definitely depend on which team you work in. And another thing that you said that was interesting is it's actually the OTs that take on quite a bit of the cognitive side. Now thinking about psychology in this channel, so not all of the teams have a clinical psychologist. Actually, fewer of the teams had a clinical psychologist. So it's mainly the allied healthcare professionals that you work with. So things like orienting someone to, okay, where are we? Do you know your name, sort of thing? Do you know the date, the place where you are? And that sort of thing. And then helping memory as well. That was definitely an occupational therapy kind of thing. So it's good. It's good for a little bit of psychology input, I think, just being a rehab assistant. And if you can just, what are the sort of nuances then between being a rehab assistant and then the technician? So that's a band higher, so presumably you have more responsibilities, more autonomy. But yeah, just very briefly, how does it differ?
So I think the main difference is that as a band 4 technician, you can assess the patient and you can treat them and you can discharge them. So you can make those clinical decisions independently. But it's just for kind of non-complex patients. Yeah. But as a band 3, you're not allowed to do that. Yeah, so I think that's the biggest difference. In the surge team, the band 4 role is more established. So they do things like kind of simple surgery for lumbar spine. They have the band 4 pathway, so the therapists don't see the patient if it's just a simple lumbar kind of surgery. So the band 4 would assess the patient and treat them and make a decision where they go after the discharge. So they might go home with like community support, or they might just go to the other inpatient rehab, or so they make those decisions. Yeah.
All right, cool. That's helpful. And as I said, the job will kind of vary. So if you have a look at the specific job description, that's your sort of best bet to see what kind of day-to-day things you'll be doing. But hopefully this will be helpful as well, just to expand on that a little bit. And my next question would be, what did you enjoy the most about the job and what were the harder parts? Sometimes we don't talk about the harder parts. We just say, what we do and what we like. But I think it's important to mention, maybe the more challenging bits as well.
Yeah. I think what I enjoy the most is the direct patient input, or like communication or treatment. It feels really nice to be part of the team, the MDT team. So like the medical team, the doctors treat the patient and nurses treat the patient, and we therapy team, we do like different things. So they all different specialities and they all have the same goal, and we work together, and then you get to be part of it. And then sometimes you can see the progress so much, and then you feel like, oh, I've done this rehab with you, and then you can do so much. Like you couldn't even like sit up independently, but now you're walking, and we be in the journey together, and then that's the thing I enjoy the most. But I think the challenging thing could be like, there are lots of challenging things, but like working in a hospital is really, it can be difficult sometimes. It's really busy and really short-staffed, and sometimes patients with cognitive impairment, they don't have any filter, so they would tell you things that might be quite challenging. And I think it, and again, like within MDT working, it's really kind of rewarding, but at the same time it can be challenging as well, because we're people and then we have like different background and different views on things. So that can be quite challenging.
Yeah, I think I kind of echo and agree. Definitely some of the challenges that the hospitals can be busy, and I love the busyness of hospitals. I love it. Yeah. But sometimes that does mean that there are too many opinions. But again, that can be any team, but in particularly in a hospital. And also the short staff thing. So I think my least favourite part of the job were the wash and dress things. Sorry.
Especially in the summer. When it's really hot.
Especially in the summer, yeah. So again, partly because of the short staff, sometimes we had to take on responsibilities, at least in the place we're working, of healthcare assistants, essentially, where you do a lot of personal care. And my first day was spending some time with a patient in a bathroom, and they had a bit of an accident, and it's sort of up to us to clean it up. So it can be difficult, but actually very humbling as well. Because you don't treat them as just a body, they're a person, and you want to keep their dignity. So that was challenging, but yeah, it was humbling, and it was a good experience. In terms of what I enjoyed, I liked the shared patient journey for sure. So some people, as you said, were not able to move at all. Maybe they had some kind of a disease, neuro condition, where they just weren't able to move at all, not even speak, not feed themselves. And then months and months and months later, and even sometimes then you'd have patients returning to the hospital able to walk, able to talk, saying thank you, bringing chocolates, getting chocolates was also nice. And for me, this was my first job out of university. So this was, real people, and not just the theory you learn at uni. So definitely patient contact. And I think the kind of the lower banding that you have, you tend to spend more time, more direct contact with the patients. And then the higher up you go, you have a little bit less time, a bit more meetings, more sort of admin or decision making time. So it's definitely good to experience that side of things. But also because I'm interested in psychology, I actually really appreciated maybe not even having an assistant psychologist position to begin with, but working in physical health, because physical health is so important. And even in psychology, sometimes people will need to work on their physical problem first before they can work on the anxiety, or at least both of them together. So definitely seeing that side of the NHS and having an understanding of, okay, this is what happens when they're really poorly in a hospital, and this is what happens afterwards. But I think seeing as well the role of psychology, I don't think there was enough psychology sometimes, I guess.
Yeah, it's not. Yeah, like we had lots of physios, OTs, but less SLTs, and even lesser psychologists. Yeah.
Yeah, and in some ways that makes sense, because you're focusing on getting them better physically. If they're on life support, then the priority is to keep them alive. But I'd like to have seen more psych input. But it was interesting anyway. So the good and bad points, some of the ones that we found at least anyway. Next question then, how about what you've learned from the experience, both just in general, what you learned, and I think we sort of covered some of this, but also if there's anything more specific to do with psychology. Yeah, what are the learning points?
I think, it might be a little bit of a repeat, but like how to talk to patients, like I think it's quite daunting.
Sorry, random like jazzish music just playing in the background. We're on the Olympic Park in London, so there's a lot going on. Back to the video.
Yeah, like just to talk to the patients is quite challenging. It was my first job after uni as well in healthcare. So yeah, it took me a while to kind of be okay with patients. Sometimes they have like tracheostomy and like things like they have like craniotomy and like the bone flap is not there, and then you can kind of see the scar, and it was quite difficult. But then you kind of get used to it, and then it becomes like normalized. So I think it was a very important like learning experience for me, and that was the good thing. Ooh, dogs barking. Yeah, so just to get used to the hospital environment and like how to talk to the patients, and sometimes they disclose difficult emotions or suicidal ideation, and then you learn the theory in uni, but then it's different when you actually see the person in distress and person who talk about suicide or anxiety or whatever. So I think as a person, I think I have kind of learned so much about emotions and like cognitive impairment or difficulties. And as a clinician, like I'm hoping to get back to psychology as well. So I think I've learned how to handle those like difficult emotions and situations. Yeah.
I think I'd add to that actually, to handle not just people's emotions, because the hospital is such a rich environment psychologically speaking, because people are not just vulnerable psychologically, but they're vulnerable sort of physically as well, and in so many different ways. And we work with so many different individuals. It's really neurodiverse. The conditions that people had were just astounding. And then the expertise of the MDT team, because it's not just the physios, the OTs, the SOTs, but you've also got the other rehab assistants. You've got healthcare assistant. You've got the doctors, the nurses, the sort of specialist consultants, the surgeons. everyone's there, and they're all sort of there to help the patient. So it was really, lovely to see that side of the NHS for me as well. And then also coping with your own emotions, like how am I going to respond to this individual? And because this was my first job as well, it was just learning about interacting with patients and just seeing the journey that people can go through, but also quite inspiring because I remember some patients that had conditions where they weren't going to recover, really terrible conditions, stuck on the intensive care unit, sort of palliative care. And maybe they were just waiting to go to one more event with their family or something. There was something that was keeping them going. And to see them still, not be completely fine, but just to be smiling and thinking about not just their own needs, but everyone else's. It was really, really humbling. So definitely a good experience. So if you're thinking of doing the job, it's definitely a good one to start off with. And kind of related to that, do you have any advice for someone who is thinking about the role in terms of both the application process or interviews, or any tips you might be able to give to someone out there that might be helpful?
I think, as I said, or as you said, it's a very good starting point if you think about working in healthcare or hospital. It's just you get to see lots of different teams and professions, how the hospital work, and it's just and it's not, you don't have too much responsibility, you get lots of support as well. So I think maybe we were lucky, our hospital is quite good, so we get lots of supervision and support, peer support as well. We had a peer teaching and catch-up sessions and things like that. So I think, as a starting point, it's really good. In terms of advice for applying, I don't know, I think it helps if you have a experience in similar settings, like social care, or I used to work in a special needs school, so I had the experience doing personal care and stuff. So I think it helped me. So to do, to kind of have the experience in a similar setting might help. And I think it's important you have the kind of, I don't know, first you need to be interested in people or helping people. I think it would be very hard if you don't like helping people. It is very much caring profession. So, and it like we talked about it can be very challenging, and some people unfortunately don't make it, pass away, and that's very difficult, but it's part of life. So if you think that it'll be too much, maybe it's not for you.
At the same time, though, if you're not scared of a job, then you're probably not looking in the right place. You should do things that are challenging. And as you say, it's always good to have experience. But then you have this conundrum: I need experience to be able to get experience to get this job. So But actually, this is a job that you can apply for straight after university, which is how I got it.
I don't think you need a degree to be a rehab assistant. So
it's very much like an entry kind of level job. I think you don't need qualifications. They might ask you for sort of basic GCSEs. But again, if you've done a psych degree, you are definitely qualified. And as you said,
most of us have a degree.
Most of us, actually a lot of people that became rehab assistants when I was there either wanted to be OTs or to be psychologists. So it tends to be people with degrees. And as you say, you need to want to help people. But I guess, again, if you're watching this video, you're probably interested in something psychology or healthcare related. So hopefully you like people. I hope you like people. But just be genuine, I guess. And very generic advice, but still useful to this one, will be read the job description. And when you're applying, apply in such a way that it's obvious that you read it. So don't just say, okay, I did this at school and this and that, but say, this is what I did and this is how it would help me for this particular role. So definitely general advice, but really good advice, I think, anyway. And then interview, again, just be yourself and just show the skills that you've got. If you did any volunteering, mention that as well at uni or anything like that. And just be be genuine, be interested in people. Questions wise, I don't know if you remember any questions. Maybe I'll let you have a think about so if you remember any questions that came up at interview. But for myself, there was one that just simply said, if a patient were to have an accident or something in front of you, what would you do? And obviously the correct answer is not to freak out, not to start running, not to start telling anyone else, but to keep their dignity. If there's a curtain, maybe close the curtain, clean it up, don't make a fuss. You had the same question. There you go. So that was one of the questions. Another.
It happens a lot, so it's good to know.
Yeah, it's a legit question. And I remember I went to another rehab assistant interview actually before this one, and I didn't get that job. But one of the questions was it was a bit of role play. So someone was, I think, sitting, and I had to help them stand up, and I had a walking frame as well. And they were scared, so they were saying, "Oh, I'm scared. I know I need to get up. What do I do?" And I just said to kind of stay calm myself and walk them through the process. But actually, I didn't know what to do with a walking frame. I know it goes before a person, so I was like, "Okay, put the walking frame there." And then I was like, and I tried to be polite and say, "Okay, you can stand up now." Actually, that's not the way to do it. Then when I actually got the job, I was like, "Okay," and now I kind of know what they were looking for. So it's things. Obviously, be nice, be calm, encourage the person. But if someone is walking, so they want to sort of position themselves closer to the edge of the seat. Often it helps if they have a hand on a handle or something. Sometimes they say, is it nose over toes? Sort of get this motion, and then it helps them stand up. But also the walking frame, if they hold on to the walking frame will fall. So oftentimes you get up from there and then you touch you grab onto the walking frame while you are standing. But also what we sometimes then would do would put our foot down on the walking frame again, so it doesn't flip. I was going to say practice with your grandma how to help us stand up. Okay, don't really do that, but just have a think about things like, okay, I might be helping physios. This might be a question they ask me. It might not be. In the second job, there was nothing sort of physical that I had to do, nothing practical. But yeah, it's an entry job. You are qualified for it. Hopefully you like people. You probably have some experience that's relevant. Just be a nice individual and I'm sure it'll go well. Good luck if you are applying. Huge thanks to I. Do you have any last comments, anything you want to add? Or?
No, I think we covered everything. Yeah. But if you want to go for the Band 4 technician job, you usually need like 6 months at least experience beforehand as a rehab assistant. So not to waste your time. If you don't have that, maybe you shouldn't go for it.
Well, definitely always read the sort of essential criteria of a job, because if you don't meet the essential criteria, there's no point in applying. But again, rehab assistant, just go for it, just do it, keep applying, something will come up. And if you have any questions for either of us, do feel free to comment down below as well, and have a fabulous day.